All right, well, it is the final week of Heart Month and all February. We've been highlighting the importance of really taking care of yourself, and today we're talking about the impact that stress can have on your heart. Here to tell us about these impacts is Dr. Yousef Grantipour with HCA Florida JFK North Hospital. And yeah, unfortunately, we're just in a go-go society, and so stress is just surrounding us. I understand there's a hormone release when we have this stress that's not necessarily good for our heart. So tell us about that and what can we do about it?
Yeah, I mean, cortisol is one of the stress hormones. It works in conjunction with adrenaline, norepinephrine, and basically flight or fight hormone, which means it increases inflammation, it increases your blood pressure, it causes vasoconstriction, it increases your heart rate. So all these factors contribute to cardiovascular disease in terms of heart failure, having coronary artery disease, and even increasing heart rate, so that can affect your heart function at the end.
And so we talk all the time, of course, eating right, exercise, but there are other things that are super important to try to keep that stress level down. Can you talk about some of those things?
So we want to first look at risk factors. So do you have risk factors? Do you have high cholesterol? Do you have family history, smoking, all those other things? And then lifestyle obviously plays a role because it is endogenously going to increase all your hormones. And everything can then subsequently affect the heart. And heart is just like an organ, like anything else in the body, so it's going to take a toll on it.
All right, so what are potential long-term consequences if we just ignore these issues?
You can end up in heart failure, you can end up having a heart attack, and you can have abnormal heart rhythm, arrhythmias. People have, stress cardiomyopathies as well. People can have coronary spasm. They come in with chest pain. Turns out they don't have a blockage, but their arteries are all collapsed in the spasm state, which is not a good condition to have.
I always like to talk about this because my grandmother experienced this. Heart problems, heart attack symptoms, so forth, present much differently in women.
They do.
Talk a little bit about that because, one, I know women often ignore them, but also because you often think initially the pain in the arm for a man, and it's very different in a woman.
So it's partly because of anatomical differences. So let's say the heart cavity is smaller, the heart muscle is a little bit different, the arteries are smaller in women's hearts. And then symptomatology also is different because of their overall, social situation, how they present and how they react. Because of the smaller arteries, their pain is not like a massive chest pain that we've seen in movies, heart attacks. So they will have more diffuse symptoms, maybe shortness of breath, maybe some chest pain, not necessarily always going to the jaw, not the standard chest pain that we've heard about.
I've always heard people think that they kind of indigestion or something. A lot of women, they say, oh, it's something
they'll present with abdominal pain, and it turns out they'll have, chest pain. They just don't know, and part of it is also the social situation. Like you said, they're stressed. They think this is all stress, their family situation, and then they miss, healthcare.
All right, women, we can't avoid those symptoms, that's for sure. I understand you're going to be part of a really important women's health panel to talk about things. When you have a chance to talk to an audience, to people out there that maybe aren't your patients, what's your biggest thing you want to get across?
The first thing is having an understanding and an insight to recognize if something is wrong or not. And once we get to that point, the second thing is we can screen you if you have a disease, and then we get to the point of what can we do about it. So the first thing is obviously recognition, the second thing is diagnosis, and third thing is then what do we have for treatment.
All right, wonderful.
So we're looking forward for a talk,
Yeah, it should be great. And of course, double check with your doctor. Always make sure that you are getting those heart health checkups on a regular basis because it could be, the difference between life and death. All right, thank you, doctor. Really good insight. Always good reminders. We appreciate it. If you would like to know more information, how stress can impact your heart, you can go to our website, WPBF.com. And of course, if you're interested in going to one of these panels, you can go to our website as well. It'll take you right to theirs. Thank you. Appreciate it.
Thank you so much,
Vanessa.